Welcome to What's Crap on WhatsApp.
We're the voice note show that investigates the crap in your WhatsApp groups.
I'm Paul McNally from podcasting company Volume.
And I'm Kate Wilkinson from Africa Check, the continent's leading fact-checking organization. Today, we're looking into if a 200 million rand COVID-19 vaccine tender went to the daughter of a South African provincial premier.
Then we're fact-checking if 70% of South Africa's commuters are transported by the taxi industry.
And lastly, we're investigating a message which claims that Port Elizabeth's COVID-19 cases are actually linked to poor drinking water.
Let's get started.
The first post we're investigating went viral over the last week. Several posts claim that a South African company, only registered on the 29th of January, has been given a 200 million rand tender to distribute COVID-19 vaccines.
Let me see. Okay, it also claims that the company, Jova Vaccine Supply, is owned by the daughter of the Premier of Mpumalanga province.
The claim has been dismissed by the Premier, but this has not stopped it from being shared on Facebook, WhatsApp and Twitter.
I see that it's even led to South Africa official opposition party, the Democratic Alliance, to release a statement demanding that the Premier must provide the DA and the South African public with proof of her innocence. Okay, so Kate, is this true?
So, Jova Vaccine Supply was registered with South Africa's Companies and Intellectual Property Commission in Mpumalanga on the 29th of January. But the company's registration date seems to be the only correct detail circulating on social media.
Yeah, the company is registered to a Sarati Simon Mashillo, who does not share a surname, as you can tell, or any other apparent connection with the Mpumalanga Premier.
And according to Mashillo's identity number listed with the CIPC, the company director is 7 years older than the Premier, Nsweni Tsepane.
Africa Check contacted the CIPC, who confirmed that they verify the identity and personal details of company directors when registering a company.
So Mashillo is a real person and is 7 years older than the Premier. News organization News 24 spoke to Mashillo, who said the organization is emphatically not linked to the Premier of Mpumalanga.
Africa Check could find no evidence that any of the Premier's children were involved with the Jova vaccine supply. But, okay, Kate, this is my question. Even if the Premier or her family have no connection to Jova vaccine supply, Kate, has it been given a 200 million rand tender?
Good question, and probably one more people should have asked. There is no evidence that the company has won a tender to distribute vaccines, and this is in keeping with statements from both the company's director and the Premier.
In fact, there is no indication that any tenders at all have been awarded for vaccine distribution in Mpumalanga.
And no such tender has been advertised by the provincial government or the Mpumalanga Health Department.
So it's another claim to add to the crap on WhatsApp.
It is.
What's next up for today, Kate?
South Africa's Minister of Health, Zweli Mkhize, has said that the country's minibus taxi drivers will be prioritized in phase 2 of vaccine rollout. That'll be along with teachers and hotel and restaurant workers. This comes after calls from some in the country's taxi industry for drivers to be recognized as essential workers.
The National Taxi Alliance claimed that the industry transports a whopping 70% of the commuting public. There are a number of definitions for the term commuter. Now, the National Transport Act defines it as a person who travels daily between home and work by means of a public transport service.
Statistics South Africa notes that in South Africa, common usage associates the word commuter with those who travel to work by public transport. And this is how commuting is defined by the National Land Transport Act.
In 2013, the data agency found that 67.6% of workers who used public transport to travel to work used taxis. Buses, used by 19.5% of workers, were the second most common mode of public transport. Trains came in third at 12.9%.
So the National Taxi Alliance's claim is actually pretty close to these estimates, and we're going to rate the claim mostly correct.
The data is outdated, but the claim is not crap. So the next one has to do with coronavirus and water, right?
Yeah, a post on Facebook warns that if you're based in Port Elizabeth, you need to ensure that you boil your water before you use it, even if it comes out the tap.
It says that, quote, there are chances that the water has been contaminated with something that is making people sick, end quote, and that this is a coincidence with the numbers of COVID-19 cases picking up in Port Elizabeth. Now, Port Elizabeth is the major city in the Nelson Mandela Bay municipality, So, Kate, what did we find out?
In 2019, the water was reported to be discolored. The municipality said this was caused by increased chlorine levels used to control bacteria levels in warmer weather.
And in November 2020, the Herald, a local newspaper, reported that the water contained aluminium, manganese, and, bear with me here, bromidichloromethane. But can the COVID-19 virus be spread in water?
Prof. Lynn Morrison, who is the interim executive director of South Africa's National Institute for Communicable Diseases, also known as the NICD, told Africa Check that coronavirus is spread through breathing infectious particles through your nose and mouth and infecting cells in the upper airways and lungs.
There is no evidence that the virus that causes COVID-19 can be transmitted through water. And Dr. Kerrigan McCarthy, also from the NICD, said the virus was highly unlikely to be transmitted by the fecal-oral route.
This refers to contaminated feces from an infected person being ingested by another person. McCarthy said that there was little live virus present in stool. Remember that the virus that causes COVID-19 requires living human cells to reproduce, and these are not present in wastewater.
Dr. Anthony Turnton, a scientist specializing in water resource management, told Africa Check that wastewater could be tested to monitor the spread of the virus in an area. But the tests, they just identify pieces of the virus. He said these are not pathogenic. They do not cause disease.
But he did say that if you are ever concerned about water quality, then it's best to boil it, and also make sure to store it in a safe and clean container.
So it's crap.
Yep, it's crap.
That's all the time we have for today's show. Now you know what's crap and what's not.
Your friends and family can sign up for the show over WhatsApp. The number is 082-709-3527. They need to save us as a contact on their phone and then send us a message to confirm.
You can find the show wherever you get your podcasts, from Apple to Spotify. If you listen there, you'll find show notes and a link to the fact checks.
Remember, you can also send us things that you want fact checked. It could be a picture, a video, a link, or a voice note. Just send them to us on WhatsApp. Our theme song is composed by John Bartman. I'm Kate Wilkinson.
And I'm Paul McNally.
Bye for now.
Volume.